AI has actually helped me think about cases differently. One of the most prominent experiences was with a younger patient who had abnormal lab values. Let's say that she had abnormal lab values, and I could not really figure out what was going on. Our specialist also couldn't figure out what was going on. And, I spent a lot of time thinking, what could this be? And this patient was pregnant. So a lot of the studies that we would normally use, we couldn't order, right? Because there's a lot of both medications and imaging studies that you don't want to threaten a fetus with. So one night, I was pacing around her room, and I actually asked if we could talk together to ChatGPT. So I pulled out ChatGPT, and this was pretty early on. So this was not an advanced model. This was the voice mode for 4, which at this point is out of date by over a year. And the two of us actually together talked to the language model, and I prompted it, and the idea was, tell me what I'm missing. What could I be missing? And then I told it what I knew. The patient filled in some of the things that she knew. And then at the end of it, it spat out a list of things that we could be missing. And this was not a case actually where it told me anything I didn't already know. The list was basically the same as what I had come up with on my own. However, the patient felt so much more confident in the list that I had come up and me as a clinician because we had worked together with an AI to make sure that we weren't missing anything. So it's not one of these like, oh my goodness, it made a diagnosis that I could never make, but it really helped like human AI patient together reinforce that therapeutic relationship. So for me, that to me is like it's like science fiction, that sort of experience with a patient of diagnostic support that involves all three of us. See, I'm counting the AI as a person, which obviously it is not, was something that to me was something new and something very exciting.